Hey guys, welcome back to our channel. Let's discuss about intrauterine devices. Intrauterine device is a small device which is inserted into the uterus to prevent pregnancy. Mainly two types are there. One is medicated and another one is non-medicated. Both are made up of polyethylene or other polymerase. Medicated intrauterine devices releases either metal ion such as copper or hormone such as progesterone. Non-medicated intrauterine devices are first generation. Intrauterine devices which releases copper ion is second generation. Intrauterine devices which releases hormone is third generation. Parts of intrauterine devices T-shaped, which is horizontal arm. It is vertical stem. It contains progesterone or copper, and last one is string or thread. First generation intrauterine devices, which are inert and non-medicated devices. Examples are Lippis loop, spirals, coils, rings, and bows. Lippis loop contains small amount of barium sulfate to detect it in X-ray. After insertion, tail of Lippis loop made up of nylon projected outside the vagina. It helps us to ensure it in place. There are four sizes of Lippis loop are present from A, B, C, D, in which A is smallest and D is the largest. Larger lipid loop has more anti-fertility effect, whereas lower expulsion rate, but it has more side effect. Larger size suits multiparous women. The mechanism of action of lipase loop are causing inflammatory response which releases product like toxic to sperm and embryo. Second generation intrauterine devices. The second generation intrauterine devices have copper. Examples are early devices such as copper 7, copper T200. Newer devices, variants of T devices such as copper T220C and copper T380A, and Nova T multi-load devices, a multi-load 250 and multi-load 375. The mechanism of action of copper T device is preventing blastocyst implantation through enzymatic interference. Third generation intrauterine devices, which are hormone releasing intrauterine devices. Examples are progesterone and Mirena. Progesterone, it is widely using hormonal device. It has got T-shaped and it is filled with 38 milligram of progesterone. This hormone is released at the rate of 65 microgram per day. It acts on uterine lining, cervical mucosa, and sperms to prevent fertilization. Hormonal supply diminished over a period of time, so regular replacement is needed. Next, Mirena. It is another third generation intrauterine device which releases 20 microgram levonorgestrel. Advantage of this includes low menstrual blood flow and fewer days of bleeding. Duration of use of intrauterine devices. For lipase loop as long as record. For copper T380A 10 years. For copper T200 3 years. For Nova T 3 years. For multi-load 375 it is 5 years. For multi-load 250 it is 3 years. Progesterone releasing intrauterine device every year and levonorgestrel intrauterine device it is 7 years. Advantages of intrauterine devices. It is simplicity and easy to insert and no hospitalization is recorded. Insertion takes only few minutes. Once inserted can be used for longer duration and it is inexpensive. Contraception is reversible by removing it. The disadvantages of intrauterine devices are painful placement, irregular periods, risk for cervical inflammation and risk for ectopic pregnancy. Timing of insertion of intrauterine devices. Best time for insertion is during menstruation or within 10 days of beginning of menstrual period. Immediate postpartum insertion occurs within the first week of delivery before the woman leaves the hospital. It can be inserted within 48 hours following delivery. Post-pubertal insertion occurs 6 to 8 weeks of following delivery. Post-placental insertion occurs it done within 10 minutes after the expulsion of placenta. In LSC's delivery, IUCD can be inserted after removing the placenta. Contraindications to insertion of intrauterine devices. Absolute contraindications are suspected pregnancy, pelvic inflammatory diseases, vaginal bleeding of undiagnosed cause, and cancer of genital organs, and previous ectopic pregnancy. Relative contraindications are anemia, menorrhagia, history of pelvic inflammatory diseases, purulent cervical discharge, and distortion of uterine cavity due to congenital anomaly. The most common complication associated with intrauterine device is bleeding. The second most common complication associated with intrauterine device is pain, and it is the most common reason for removal of intrauterine device before completing shelf life. Let's solve this MCQ. Lippis loop is a type of contraceptive used as cervical barrier, vault barrier, non-medicated intrauterine devices, copper releasing devices. The correct answer is non-medicated intrauterine devices because Lippis loops are comes under first generation intrauterine devices. The first generation intrauterine devices are usually non-medicated. Thank you for watching this video.